Navigating the maze of Medicare can be frustrating, but it doesn't have to be. Hi, I'm Marvin Music, the founder of MedicareSchool.com, and for over 15 years, we've been on a mission to demystify Medicare and help people make confident Medicare decisions. Every month, our team helps over 2,500 people learn about Medicare and begin Medicare with peace of mind and confidence. In the next few minutes, this video will reveal everything that you need to know about Medicare. We'll show you how and when to enroll in Medicare. You'll learn about Medicare's financial risk, and we'll show you how to protect yourself from both penalties and hefty medical bills. We're going to break down the 5 key differences between Medicare supplemental plans and Medicare Advantage plans and show you how you can easily decide which is best for you. Plus, you'll learn how to select the best prescription drug plan and reduce your medication cost. By the end of this video, I can promise you, you'll have a clear understanding of your Medicare options, you'll eliminate any Medicare stress, and you'll know exactly which insurance plans suit you best. So let's get started. The first thing we have to address is, do we need to go on Medicare at 65? So if you are starting Medicare, notice at 65, this is the process that you're going to be following. We call this the initial enrollment period. Now, keep in mind, if you're on a retiree plan, a COBRA plan, Affordable Care Act plan, TRICARE for life, or you're working for an employer your spouse is that has 19 employees or less, you have to go on Medicare at 65. And so if you're already on Social Security, you're automatically enrolled by them and you'll get your card about 4 months before your 65th birth month. But if I'm not on Social Security, I'm going to have to self-enroll, and we have 7 months to do it. And when we enroll determines when they start our coverage. So if I enroll 3 months before my birth month, my coverage starts on my birth month. But if I enroll during my birth month, in this example, July, they'll start me in August. I enroll in August, they start me September, enroll in September, they'll start me in October, and October they'll start me then in November. But I must enroll during this 7-month window. If you don't, you're going to be making a mistake. Now, not everyone's going to start Medicare at 65. They're going to start, notice, after 65. So this would be only those people that they were working or their spouse was, and there were 20 employees at the company or more, and you're covered by the group plan. You're going to come into Medicare at a later date, maybe 66, 67, or beyond, and that process is called an SEP, Special Enrollment Period, and it has 2 additional papers that are required that weren't required during the IEP, and that is what's called the L564. And what this does, this proves to Medicare that you've had credible insurance at work. You were working, your spouse was, and we had coverage at work. The L564 has to be completed by your HR department, and then we take a form called the CMS 40B, and what we do here is we tell Medicare when we want to start. So if my group plan ends June 30th, I want to start my Medicare 7-1. I prove I'm eligible with the L564, and I put on my form 40B, I want to start my Medicare July 1st, whatever year you're going to begin. So this is the process of coming in after 65. Now keep in mind, if you or your spouse are still working and you're covered by a group plan that has 20 employees or more, you may want to consider going on Medicare and not staying on the group plan. What you want to do is do a comparison. What's the premium that it costs you to be on the plan? What's your deductible? Max out of pocket if you had to get cancer or a serious health issue. So you're Medicare eligible. You don't have to go on Medicare if the group is 20 or more, but you may want to if it makes financial sense to do that. So once we've made the decision to start Medicare either at 65 or beyond, now we're going to look at what our coverage is going to look like. And so there's actually 3 different Medicare options available to you. Number 1, you can make the choice to have Medicare A and B only. A is going to be 0 premium and B is going to have a cost. Right now, that's $164.90 a month, and that's all you'd be out of pocket. However, if you had a healthcare service, you're going to be out of pocket a tremendous amount of money. The second option is to do A and B, and we have a supplemental plan. This is a private health insurance company that fills in the gaps that Medicare does not cover. And in this scenario, what we're going to do is we're going to add a prescription drug plan. I'll tell you more about that in a few minutes. The third option is to do what's called a replacement plan, a private health insurance company. These are also called C plans. These are alternatives to original Medicare. They're replaced. We also call these Advantage plans. So you're going to have to choose which one of these 3 options are going to be best for you. So these are our 3 options. Rarely will someone do this. Most people are going to choose either number 2 or number 3, and we'll look at those details next. Now let's talk about the original Medicare system, the A and B of Medicare that started back in 1965. Now listen, those of you that are going to get a supplemental plan, this is critical that you understand this. Okay, so Medicare is broken up into 2 parts, A and B. A is hospitalization, it is skilled nursing facility, as well as hospice care. So when we have Medicare Part A, most people are going to have this at a zero premium. You pay into Medicare all your life and they don't charge you a premium for Medicare A as long as you have 40 quarters. Now, as far as the coverage and the financial exposure that you have, we call these gaps in coverage. So we start off with the first gap of the deductible. So if I go to the hospital, it costs you $1,600. The good news is that's all it costs you for the first 60 days in the hospital. If you happen to be in the hospital longer than 60 days, that takes us to our second gap, and that would be extended hospital stays. So month 3, $400 a day. Month 4 and month 5, $800 a day. And then that takes us to our last gap, which is called skilled nursing facility after a stroke or a hip replacement. The rules are, must be in the hospital 3 days, go to skilled nursing. Medicare covers everything. The first 20 days doesn't cost you a penny as long as we had that 72-hour stay in the hospital. After that, if I'm still in, I have 80 more days of coverage by Medicare, but you will be out of pocket at $200 a day copay. So that's the Medicare A. Medicare Part B is the medical side. This is everything outpatient, all doctor services, as well as durable medical equipment. And so with Medicare Part B, it is not going to be zero. There's going to be a cost to it. And so most people, 90% of the population, pays $164.90 a month. Comes out of your Social Security check, or they'll bill you quarterly for this until you take Social Security. Again, we have 3 gaps. We have a deductible. This deductible is $226. It's once a year. After we've met that small B deductible, we go into what's called coinsurance. Medicare pays 80% of the bill of everything on the B side, and you're responsible for 20%. Your problem is that 20%, if you have no other insurance, never, ever, ever stops, and this is where the doctors are paid. A lot of liability. Thirdly, we have what's called an excess charge. This is when you see a physician that takes Medicare patients, but they will not accept Medicare-approved amounts as payment in full. They add to the bill, they can legally add 15%, and when they do that, you're responsible to pay for it. Again, that's the 3 gaps that are on Medicare. So we have 3 gaps on the A, 3 gaps on the B, and this would be your financial liability in original Medicare. So if we make the decision to stay in original Medicare, you can see there's a tremendous amount of liability there, an exposure that you're going to have to pay out of pocket. Most people don't want to do that. So what we do is they will actually get a Medigap policy. These are also called Medicare supplemental plans. That's synonymous. Now, about 95% of all people, though there are 10 plans available, buy one of 2. The top plan right now is called the Medigap G policy. And again, it's going to fill in the gaps. And so what the Medigap policy will do for those who buy it, it will cover everything on the A side, so all gaps are filled on the A. It'll cover your full 20% coinsurance and excess whenever that occurs. So the only thing it does not cover once a year is the annual Part B deductible, and that resets every January. So every year you would be out of pocket the first $226 for anything coming through the B side of Medicare. And obviously, to get rid of all those gaps, you're going to have to pay a premium to an insurance company to take that liability from you. And again, those premiums are very, very reasonable. Now let's look at the second most common plan. Again, the G is a little bit more popular than this plan, but it's still a very good plan called the N plan. And so the way the N plan is going to cover you is this. It covers everything on the A side. So again, anything on the hospital, skilled nursing side, nothing out of your pocket. On the B side, here's where it differs from the G. Remember, the G, you only had to pay the B deductible. The N, what happens, it will cover your full 20% coinsurance, but it will not cover excess and it will not cover the B deductible. Now, there's one additional and frankly very unique item you're going to be responsible for if you decide to get a plan N, and that is this. Every time you see a doctor, you're going to be subject to a $20 copay. If you go to the emergency room, you're going to be subject to up to a $50 copay. So we have to pay the B deductible, excess if and when that occurs, and when we see a doctor, we're going to be out of pocket on that as well. And really, that's what people have to decide is how much risk they want to take and what are they comfortable with a monthly premium. Now, keep this in mind. It's critical that when you first go on Medicare and we start our Medicare B date, we have 6 months where you can get any of these policies, the G, the N, or anything else that you want with no underwriting required whatsoever. Those companies have to take you. So the next option we want to look at are called Advantage plans or replacement plans. And there's 10 specific features that you need to be aware of on Advantage plan. Number one, that Advantage plans replace original Medicare. Now, you're enrolled in Medicare, but you're going to take the A and B card and put it in the drawer because now you have a private health insurance company that's going to replace your original Medicare benefits. Secondly, you have to be enrolled into Medicare A and B. And so what happens is A is free for most people, but B has a premium of $164.90. And it's required that you stay enrolled in A and B and pay your Part B premium. You also have to live in what we call the plan service area. This is a geographical area. It could be a metro area, it could be multiple counties, could be a whole state, but you have to live in the plan service area to get that plan. Also, you must choose a network of providers. There's two options available, HMOs and PPOs, which means they're going to have doctors that will participate in both of these, doctors that may participate in one or the other, and some doctors don't participate in any of the Advantage plans. Now, the sixth feature of the Advantage plan is that they will have low or no monthly premiums. Almost every company has a zero premium plan, or they're going to be very low cost, typically less than $30 a month. Now, keep in mind, we still have to pay Medicare, our Part B premium, $164.90. And the reason the companies don't charge a premium to be on their plan is because out of pocket, instead of paying a premium, you pay as you go. In other words, you could have a deductible, you could have co-pays you're responsible for, you could have co-insurance that you're responsible for. So you pay as you go based upon the healthcare services that you need. Now, with the pay-as-you-go system, there will be a limit. We call that an annual max out of pocket. It's given the acronym the MOOP. And so what happens is you have co-pays. You go to the hospital, it costs you $350 a day. See a specialist, maybe $50. Have an outpatient surgery, $250. But all these co-pays are going to the annual max out of pocket. And then if you ever hit the annual max out of pocket, you no longer have to pay anything else. The plan covers you 100%. And then those max out of pockets will reset every January. And we start paying again as we go. Now, also with Advantage plans, there will be a drug plan that's included. It's just part of the package. They pick a plan and embed it within the Advantage plan. So it covers inpatient, outpatient, as well as prescription drugs that you pick up at the pharmacy. And then also Advantage plans have several perks. They could put a dental allowance in, a vision allowance in, could be hearing aids, a gym membership, maybe the over-the-counter card. So there's a variety of perks that are included in Advantage plans, which make Advantage plans attractive for some people. All right, let's quickly review our three options that we looked at. Number one, we said someone could have A and B only. As I told you, I would caution you, I would never do this because there's a tremendous amount of risk that's involved, especially if you had a serious illness. This is what puts people, frankly, into bankruptcy. I would not choose that. The second option is to do an A and B original Medicare and get a supplemental plan. Remember, we said the G plan, the N plan are the most popular plans. Now, again, you're going to have to pay a premium for these. These could be anywhere from $90 a month to maybe $125 a month. And some people can afford that, some people cannot. Now, when we stay in this system, we're going to have a drug plan, and it's separate. It's a plan you get to choose. And these are going to have a premium as well. These could be anywhere from $5. I think the average right now is about $30 on a monthly basis. And again, you have to afford the premium. Now, if it were me going on Medicare, this is what I would choose because I think the features of these are very, very attractive. But sometimes people cannot afford that premium or they don't want to afford the premium. And that takes us then to the Advantage plan option. I would tell you, I would much rather have an Advantage plan than this A and B only. There's just too much risk up here. At least here, they're going to set a max out of pocket for that particular year. So I limit my exposure, I limit my liability. Now, when it comes to drug plans, as you saw up here, we added one. When it comes to drug plans with Advantage plans, they're going to embed one or include a drug plan as part of their coverage. Now, the final part of our Medicare plan has to include some kind of drug coverage. Now, remember, if I have A and B with a supplemental plan, I have a separate or standalone drug plan that we have chosen. If I choose an Advantage plan, those C plans, it will include a prescription drug plan. Either way we go, what I'm ready to teach you is going to apply to those plans. So number one, every drug plan is going to have a network of pharmacies. Some pharmacies will be labeled as preferred, which means better pricing, and others will be labeled as standard. Obviously, preferred is going to give you a better price. So if you can go there, that's best for you. But if you go to a pharmacy that's standard, it just means your copays are going to be a little higher. Now, the second aspect of a prescription drug plan will be the formulary. Now, the formulary is nothing more than the list of medications that are covered by the plan. Most plans are going to have anywhere from 2,500 to maybe 3,000 medications that are covered. There are some plans that have a broader formulary, and those typically are going to have a higher price. But the formulary is the most important part because you want your medications covered. The third thing we'll look at is the term of drug plans. They're only written for 1 year, and that means every year, October 15th through December 7th, if you need to get on a different drug plan to maybe increase your coverage or decrease your coverage, you make that decision and the new drug plan would start January 1. Then the last part, and frankly the most confusing part of Medicare Part D plans, is we have 4 phases. And all that simply means, depending upon the phase that you're in, your copay can change. So all the plans start off with phase 1, which is called the deductible. That deductible is $505. And that just simply means your copays are applied to the deductible. If I meet the deductible, I moved to the next stage, which is called the copay stage. Here, medication is very reasonable. Could have a $5 copay, a $25 copay, but again, they're very reasonable. But what's happening here in this stage, Medicare tracks the retail cost. And if my retail cost ever reaches $4,660, and again, not your cost, total retail. If I reach that, most people don't, but if we do, that puts us into what's called the donut hole or the coverage gap. In this phase, I pay 25% for the cost of my medications, and the manufacturer has to discount 70%, and so my out-of-pocket cost will be fixed, but it's going to typically be higher in this phase than in that phase. And then, if I ever get out of the donut hole, most people don't, that would put us in catastrophic, where all I do is pay 5% for the cost of my medication. So you can see, depending upon what phase you're in, that will determine what your copay is going to be. Now, just one last thing. Sometimes people are tempted not to get a Part D plan. And the reason they do that is because their meds may be cheaper cash, GoodRx coupons, and they don't see really the worth of spending a premium to get a prescription drug plan. Please don't do that. And the reason for that is, yeah, your meds may be cheap now, but you may have some serious health issue in 3 months or 6 months, and you may need a $7,000 a month medication. If you have a drug plan, you'll pay pennies on the dollar. But if you don't have a drug plan, you'll pay full retail cost. So for those of you that really want almost no risk, you will go with A and B and a supplemental plan. Those of you that are comfortable taking on a little bit more risk, you'll probably go with an Advantage plan. Now, either way we go, we have to be enrolled in Medicare A and B. We're going to have to pay our B premium. Again, $164.90 a month comes out of your Social Security check or your bill directly quarterly. Okay, now let's compare these two systems, because you have to choose one or the other. You cannot be on both. So if you stay with the supplemental plan, you will notice that you can go to any Medicare provider. You don't even have to ask them if they take your supplemental plan, because if they take original Medicare A and B, they will take your supplemental plan. If you have an Advantage plan, it won't be like that. Because it is a network of providers, you're going to have to decide what providers are going to cover you best, whether that's the HMO network or the PPO network. And again, not all providers take Advantage plans. Some take both, some take one or the other. But again, that's the difference. The second difference is premium-based. We've talked about this. On premiums here, we have to pay A and B. We're going to have a very reasonable supplemental premium to pay, as well as a drug premium that we have to pay. Got rid of most of the risk when we pay the premiums. Over here, it's pay as you go. Again, we paid Medicare, but the plan usually doesn't charge you anything to be on their plan, because instead you're going to pay as you go. Go to the hospital, see a specialist, have an MRI, have an outpatient surgery. You're going to pay copays and deductibles and coinsurance, all applied to the max out of pocket. Thirdly, when we have a supplemental plan, we have a separate drug plan. You get to pick that out based upon the meds you take and the pharmacy you want to go to. If we have an Advantage plan, the Advantage company pick that out, and they've included that. And frankly, sometimes they're good. Other times they're kind of mediocre, so you got to be careful with that one. Number 4. Now, this is a big deal, because supplemental plans, notice, do not require pre-authorizations at all. That means that you need an MRI or a CAT scan or an outpatient surgery, a knee replacement or a hip replacement, something with your health that is going to be more on the expensive side. And so when it comes to supplemental plans, there are no pre-authorizations. If your doctor says you need a knee replacement, hip replacement, MRI, doc says you need it, Medicare says they'll pay for that, end of story. That insurance company has no say-so whatsoever. Medicare pays. They have to pay based upon the supplemental plan that you bought. When it comes to Advantage plans, there will be pre-authorizations. They say right now about 72% of all services that someone needs on the Advantage plan will have to be pre-approved by the company. So when the doctor says you need it, that's not the end of the story. We have to get approval by the Advantage company. And so they're going to submit paperwork to make sure that the Advantage plan agrees that you need that knee or hip replacement, or that MRI or that skilled nursing stay. And sometimes they give immediate approval, but sometimes they say, no, we're going to delay that for a time. We'd rather you try medications or try therapy. And sometimes they just flat deny that. And so you have to be aware that Advantage plans do have pre-authorization. So that's a big difference between these two systems. And then lastly, when you buy a supplemental plan, like Medicare A and B, it is written for the rest of your life. The only way a supplemental plan can ever be canceled by the insurance company is if you don't pay the premium. You have that policy for life. You move away, take it with you. It's the same coverage anywhere in the country. And so it belongs to you. It's tied to you. It's a lifetime policy. When it comes to Advantage plan, it's really tied to, as we saw earlier, a service area. And it's only written for 1 year at a time. And that's why the plans kind of come and go, and why we have to have open enrollment every year for people to switch Advantage plans if they need to. So these are your 5 big differences. So as you look at these differences, you're going to have to decide which is going to be best for you. So keep this in mind. If you decide that a supplemental plan is going to be in your best interest, when you first go on Medicare, Part B, you have 6 months where that insurance company has to take you. There's no underwriting required whatsoever that first 6 months. Now, if you decide to take an Advantage plan, again, there's no medical underwriting, but if you stay on that Advantage plan for a year, 2, 3, 4, 5 years, and you would like to move from Advantage over to supplemental plan, in 46 of the 50 states, you have to medically qualify to make that move. And so if you have some health issues going on, that insurance companies does not have to approve your application for that supplemental plan. So the last thing that you need to learn is what it looks like to get help with your Medicare enrollment. You really have 2 options, and I'm going to set these side by side for you so you can choose which one is best for you. First, you have captive sales agents. They work with only one company, so their options are limited to whatever company they represent. If you call Humana or Aetna, you can be sure they're going to say their plans are the best. Independent brokers, on the other hand, work with a big number of companies, which means they can offer you a vast array of options to choose from. You can truly choose what's best for you. This is a much faster way to go about it, to see everything all at once. Now, when it comes to the price of insurance plans, you'll find that the price is the same no matter who you choose, and generally independent brokers are dedicated to finding you the lowest possible price, while captive agents don't have that flexibility. But the insurance companies, together with the state insurance commissioners, set the price of the plans, and however you enroll, whether that's online or a calling call center or through an independent broker, the price will always be the same. So what does assistance look like? Well, both captive agents and independent brokers offer free assistance. You never have to pay them for their services. However, captive agents tend to focus on selling you their favorite plan and leave it at that, whereas a good independent broker will hopefully provide comprehensive services, including A and B enrollment, IRMA appeals, SEP paperwork, and help with Social Security, Medicare supplemental, and Advantage plan comparisons, and assistance with drug plan options and strategies for lowering your medication cost. What I've learned over the years is captive agents usually have a one-size-fits-all approach, while independent brokers customize plans to fit your specific needs, ensuring that you get the right coverage for your situation, and they handle all the details, not just the enrollment. Now, if you haven't picked up on it yet, our company, MedicareSchool.com, has a team of independent brokers on our staff. They're all licensed in all 50 states, and they've all been trained by me personally to help you find the right coverage. Now, if I'm in your shoes, the biggest question I have is what happens after you help me enroll? Do you just go away? And that's what I'm most excited about. When it comes to customer service, when you go through a captive agent or you enroll directly with the insurance company, either online or over the phone, you're given a 1-800 number, and guess what? You never know who you'll be speaking with. In contrast, if you work with us, you'll have access to a 100% US-based customer service team, ready to provide personalized support wherever and whenever you need it. No getting transferred 10 times and end up on the other side of the world talking with someone who hasn't been trained very well. Now, the choice is clear. By working with an independent broker like us, you're not only going to get a tailored plan that fits your needs, but also the peace of mind knowing that you have a dedicated team backing you up every step of the way. Don't leave your Medicare enrollment to chance. Schedule an appointment with us today and let us guide you through the entire process. It's completely free and there's nothing to lose whatsoever. We're rated 5 stars on Google, Trustpilot, and Facebook, and we have an A+ rating with the Better Business Bureau. Every month, we walk a couple thousand folks just like you through this process, and we're confident that we'll help you have peace of mind in your Medicare planning. To schedule your appointment, simply book an appointment on this page or give us a call. We can't wait to help you navigate the world of Medicare with confidence.